welcome back to Fort Wayne on the Move with me, Councilwoman Michelle Chambers. I am super excited about our conversation we're going to have today. It's going to be all about EMS services right here in Fort Wayne, Indiana. And today we are at Fire Station number 1 downtown. Welcome, gentlemen. I have been waiting for this conversation. So before we get into introductions, just a little trivia for me. Fire Station 1, does that literally mean this is the first fire station in Fort Wayne or no? No. I thought we had a historical moment, but okay. Down with the trivia. So if you will, we'll start here. If you will introduce yourself, your name, and tell us your title and what part of EMS are you representing today?
Okay, I'm Cody Brooks, Deputy Chief here at Fort Wayne Fire Department, and I was the previous EMS Chief and now serve as the Deputy Chief in this role, but I've worked with these two gentlemen for a very long time.
Yeah, so Fort Wayne Fire Department, yep. Deputy Chief.
Yep.
And who's this gentleman here in the middle?
My name's Dan Etzcorn, and I'm the Assistant Chief of EMS for the Fort Wayne Fire Department. Previously was the District Chief of EMS, so just a little bit of a title change.
Okay, badges are changing, and who do we have here?
Joel Benz, and I'm the Executive Director at Three Rivers Ambulance Authority.
Wow, so welcome, welcome, welcome. This is going to be a wonderful, robust conversation. So I always like to ask, just in case we have younger folks viewing us today, how did you get into your career? What was your pathway? What made you decide that I'm going to work with the Fort Wayne Fire Department?
Sure. That's kind of a long story, but I'll try to summarize it here. In high school, we sat down for lunch one day, and there was a table in the corner of the lunchroom, and there was someone over there talking about fire and EMS. And I went over to the table and just to get a little more information, and they had like an Explorer program. So in the early 2000s, I started an Explorer program in high school. I joined New Haven Fire Department in 2005 as a volunteer and with paid on call. Transitioned to a more professional career later on around the 2010 timeframe. I served there until 2016 when I transferred over to Fort Wayne Fire Department. It just led me through.
So it's been going from there. That's a great example of exposure for young people.
Absolutely.
When you get to learn about something new in a career, sometimes it just clicks for you, and then on your pathway.
And I just.
And you kept going. How about you? What's your story?
So I grew up with my grandma and grandpa working for Southwest Fire District. So I would go hang out there with my grandpa, and my grandma would come from home for EMS runs and get on the ambulance, and we would go to the EMS response. I too started in high school. I did the ANTHUS program through the ANTHUS Career Center.
Yes.
So that's kind of where I got my start in 2007. And then in 2010, I started with the New Haven Fire Department full time. And then I got hired at Fort Wayne in 2014. So
nice. Okay, Joel?
Yeah, so I have a little non-traditional route to EMS, actually. I was homeschooled, and so when I graduated from that, I was looking around to see what options there were. They did search and rescue. It was called Alert Airline Emergency Resource Academy. And so I was Michigan. I went to that and was there a couple of years. And as I was going through it, I was planning to come out and do construction. They had a course in EMS, and my dad's like, "Have you ever thought about doing something?" And I thought, well, I'll give it a try. So I did. Got on the ambulance and heard the sirens and got that bug, as they call it. And so 20-something years later, here I am.
20. None of you look old enough to have been in your profession a long time, so you must really enjoy what you do. So I'll start with you, Joel. You did a non-traditional path, but you are here. We'll talk about that other career you have for a minute later. But what's the best part of your job?
The best part of my job, twofold. One, taking care of people, right? In the EMS, seeing impact on somebody's life. The other part now is I'm sort of more on the administrative side. So bringing along the next generation, the next leaders, really investing in them and seeing them grow and develop. That's been really rewarding in the current phase.
I love to hear that, the intentionality behind bringing on the next generation. That's critically important because oftentimes, like you went to a high school career, people don't know that there is a great career pathway in EMS. So that's awesome. What's been your best part so far?
I think we all share the same thing about just helping the community in a time of need. But currently in my role as well, just like Joel said, trying to figure out what's the next step and then developing protocol and training programs to prepare our responders for those next steps or what may be up and coming as far as the in the EMS world and realm to be able to help and provide that service.
To be of service to community and help. And how about you?
And I'd have to echo these. I really enjoy serving the community. I love taking care of patients, and most importantly, I love the team. Fort Wayne Fire Department, it was just an amazing group of men and women, and just working with this team every day is a highlight for me.
So speaking of which, Fort Wayne Fire, are you all 24 on, or does EMS have the same schedule as a traditional firefighter, or is it a little different?
No, it's a little different. Here in operations, it's 24 on, 48 off.
Okay.
In our positions, we were Monday through Friday. More of that administrative piece overseeing the fire department.
Oh, I see the operational side of it.
Yeah, the folks in operations are in 20.
Okay, 24, 48. And is yours a?
Yeah. So
Well, because TRAA is 24/7, right?
Yeah. So we have a day shift, and those shifts are about 12 hours or 14. We have some 10-hour-long shifts, and then we have a night shift that comes in. We offset the start of our shifts so that, we have somebody coming in at 4 a.m., 5 a.m., 6 a.m., 7 a.m., and then kind of the nighttime is the reverse of that. So that way we can, not everybody's going home at once, so not all the ambulances are getting pulled off the street at once. We kind of have this overlap that works out really well.
Interesting. So TRAA and Fort Wayne Fire Department EMS services, you work separately, but there's some connections, right? There's some connections that happen. Can you, anybody can jump in on this. Can you explain how it works? Is it a service area, or is it a type of call or location? Is there overlapping, or is it very specific how these runs work? Is that the right terminology for you?
Pretty good.
Was I? Oh, okay.
Most of the time, the Fort Wayne Fire Department will respond on life-threatening injuries.
Is that determined by the 911 call if it's life-threatening, or?
So yeah, they'll go through questioning.
Okay.
It depends on kind of what they say. They can determine if it's a lights and siren emergent response, like if someone's having the difficulty breathing or actively choking, they could be unresponsive. And so that would generate a run through the full ranks.
There's lots and lots of clinical data behind that says, when you're a caller, if you say certain things, we'll put you in this slot. And in the business, we call it priority 1, and then there's other priorities 2, 3, 4, less acute. And so there's been lots of research over the years that kind of helps determine that. And our dispatchers are really skilled at making sure they ask the right questions and bringing that along.
You were living in my head. You said dispatcher. So I don't know if this is a question, gentlemen, that you can actually answer, but when you said dispatch, so the 911 call, they decide if it goes to TRAA or goes to Fort Wayne Fire Department, that person that receives that call?
So any time you call 911, it goes to the PSAP, which is the 911 call center.
Okay.
So then they answer the phone, they start talking to the person. If they determine it's a medical emergency, and then they transfer it over to TRAA, to our dispatchers, who then start asking those questions. So that's kind of mandated by state law, how that all works. If it's, something more like it's just a burning building or it's a police response, then they kind of stay on the phone and kind of work through, getting the right responders there. So it's a process.
It's a process.
For sure.
Interesting. So Fort Wayne Fire Department is a city department. So, your funding comes from all, property taxes and grants and things of that nature. Now, TRAA is not a city department. How are you funded? I mean, you're doing this public service. You're saving lives. Are you considered a private company that services the public? Is that too?
No, that's
okay.
a great question,
Okay.
because I think a lot of people have a misunderstanding. So we are a governmental unit. We're established by an interlocal ordinance, but we are not part of city government. We're our own kind of little entity, and we have ward appointments. They used to be from the city and the county. Now it's just the county kind of pulled out, so we just have city appointments from the mayor. But then we have one person that is actually from the EMS Foundation, which is just it's actually a physician who provides some oversight, and his intent or focus is really on medical outcomes and things like that. Making sure we're doing and a good job of that. And so it's interesting the way this is set up. Also, that EMS Foundation is made up of doctors from different hospital systems, and they come together and they select a medical director that oversees both our medical operations and Fort Wayne fires. Yeah, so kind of
There's that overlapping.
yeah.
Interesting. How long has TRAA been around?
1983 is when we began operations.
1983. There's a board.
Yep. And then you asked about funding.
Yes.
So we are not tax funded. That's, I think, a unique thing. Most places have some level of that. We have been able to operate, except for a brief period there where we were really upside down without tax funding. We use user fees. So when we take you to the hospital, we get paid for that. We've also recently started going into doing mobile integrated healthcare, which is where we send somebody out and developing contracts for that and look for a lot of grant funding. Yeah, we are totally, for the most part, self-funded. And that's a really unique thing. We don't have to put that burden on taxpayers to support us.
And Joel, I'm going to take a point of privilege. When you started in your position, fiscally, it was a challenge. But under your leadership, there's been great growth. Things have turned around. So kudos to you to even say yes to the call when the opportunity came across, because you walked into a situation that may not have been ideal, but you've done a great job in changing the course of TRAA.
Well, thank you.
Yeah.
I consider it an opportunity, a blessing. It's something I never thought I would have the ability to do. And when the doors opened, I consider it a privilege, I guess that's where I should consider.
It really is a privilege for us to be able to be of service to the public. I'll say that. I'll agree with you on that. So, gentlemen, for Fort Wayne Fire Department, are all of the fires EMTs?
Yes.
So tell me about that. How does that work?
We currently have 4 levels of EMT certification. Back, 20 years ago when we got on, we were a first response. So just very basic EMS care, ventilating a patient, just doing very basic things. Those are called emergency first responders. So that's the older generation that are kind of getting close to retirement. Now that's kind of their certification level. The overwhelming majority of the fire department is the EMT level, so more of a basic level of EMT skills where they do CPR, AED, airway maneuvers, things like that. And then we've also implemented an advanced life support program. So we have advanced EMTs, and then we also have paramedics.
Does that training all happen when you first come through academy?
We've done a couple different transition periods. So currently, we're doing the EMT certification as kind of like the base level. There was a time frame when we were building up our ALS program that the oncoming classes were
ALS program?
advanced life support.
Okay.
So yes, so advanced EMTs and paramedics. There was a time period in which we trained those individuals to the advanced EMT level as part of their initial training. So we currently have about 110 advanced EMTs and about 40 paramedics that operate on a shift-by-shift basis.
So will everyone in the department one day be an EMT? Is that an option?
An EMT, yes. An
Yeah.
advanced EMT or
ALS.
no. So
Okay.
balance those out depending on the need and the opportunity in the fire department.
Is that-
Currently, every piece of apparatus that responds on a medical emergency has some sort of advanced EMT or paramedic on it.
Is that why the big trucks come out to all the big calls and everything? Because everybody,
Yeah.
it's perplexing to us. We're like, why they came for the lady who fell, but it's okay. Don't stop coming. But it's the level of care and service that may be.
I think it's a good point that, that's how the two agencies work really well together. We have 18 fire stations spread throughout the city. And then they also have, depending on the time of day and the day of the week and the night, ambulances spread throughout the city. So by sending 2 pieces of apparatus or 2 different agencies to the same response, we have the ability to get there as quick as possible to provide that, care that's necessary right away.
Joel, how many ambulances do you have? What type of, ambulances do you have? Yeah.
We have physically 20 ambulances, but time of day of the week varies on how many are actually in service out there serving the community. So at night, it's probably like 8. Our call volume goes down. And so we're staffed to the level of, so we're able to respond. We use computer modeling, things like that to determine where we're going to sit. So we call it guarding parking lots, as fire stations like these guys. So our office is the ambulance, which there are some advantages to that. We're right there ready to go at all times. And so we can get en route quickly. And then, it allows us to provide a really good response to the community.
Interesting. So being a EMS person is not for the faint at heart. So if you had to talk about the type of person that it takes to be able to be in these life-saving situations, if someone's thinking about even going into EMS, what are some of those characteristics, or what are some of those innate things that you think that a human being, a person needs to be an EMS person?
Sure. I would probably start off with being a good team player.
Okay.
So everything we do is as a team. So nothing's individualized. It's always.
So is it really like we see it on TV? It's like a lot going on, but you're communicating, you're asking for things.
Yeah.
So that's how it is out there in the field.
Yeah.
It can be.
Absolutely. I would say, to be a good team player, have some patience. All of our different types of patients we see, it could be, somebody that needs help up off the floor to treating someone with a gunshot wound, or so you have to be able to overcome some of those hard things in the field too.
Mm-hmm. And for you, Joel, what are you similar characteristics that? Are there tests that we have to take to become an EMS, like personality tests? Does that? No.
We did recently implement a personality test in our hiring process, just because we kind of wanted to see, are there things that make somebody stand out as an EMT? And what we've really discovered is that it used to be in this industry, it was a type A personality. Like, I'm going to be here, I'm going to be in charge, I'm going to take care of this, and do all those things. And then what I think has changed, and what people have started to realize, is that that's not really, you can be a different type of person and still provide the same level of care. It's really, it's really more about being committed to what you're doing, taking the time to learn, to really become good at the craft. And so there's not necessarily a type of personality that, does better than another. They each bring something different to the table.
Right.
So it kind of goes back to what these guys were talking about, being partners.
The team.
That's really what it's about.
Yeah. So Joel, I did ask you the number of ambulances that you have. Now, you used to service the county, correct? I said used to service the county. However, TRAA is just inside the city limits now. And how does that work?
So that is a really confusing thing.
Is it? Okay.
Yeah. But
we'll give it a try.
The county withdrew from the interlocal. However, there are still portions of the county that we cover. So we are the only ALS provider in St. Joe Township, which is, there are some unincorporated on the northeast side of town. And then also Monroeville area, kind of that whole area out there. We still send
Oh, you get that?
paramedics out there to help them when they don't have a paramedic on staff all the time. Matter of fact, they don't even have staff all the time. So we are sort of backfill for them. And that's a good partnership. But we primarily focus on the city of Fort Wayne. That's where we do, where we post our ambulances. We don't post them outside in the county. And so primarily focused on the city at this moment.
Now, did this change impact Fort Wayne Fire Department EMS at all? Did you notice a change at all in calls or runs or anything like that? No? Pretty much the same? Okay. So we get calls in urban, rural areas. How do you handle, is there a difference in how you respond to an urban call versus a rural area? Is it challenging when you go out in the rural areas? I don't know if there's a difference when it comes to EMS service. Can it be a difference?
I think EMS-wise, if you're looking at a pure ambulance standpoint, rural areas have longer transport times to facilities for treatment. So therefore, you're with a patient for a longer period of time.
How do you figure out when you are rural, is it mapped out for you? Well, we go, this is where we're going to drive. This is the closest and nearest.
The closest appropriate is what we call it.
Closest appropriate.
Yeah, so depending on the type of run, a cardiac patient would probably go to Lutheran or PRMC based on the care that they're able to provide 24/7.
So like they have a cath lab there. So that's why we would go pick certain hospitals when we go to the hospital.
They have a what?
A cath lab where they can do, the way to do surgery on the heart.
Oh,
So there are certain hospitals that have certain things. That's why we choose to go there. I'm sorry.
all right, gentlemen. So what's the changes? Do we have to ever worry about not having efficient, timely services? I don't know.
I think it goes back to the partnership and the ability to have 18 fire stations and ambulances throughout the city. There's always somebody available to respond to that incident. And to know that every piece of apparatus, at least with the Fort Wayne Fire Department and with TRAA, is that you're getting an advanced level provider that's going to respond to that incident as well to take care of you in time of need.
Yeah. We did a study here not too long ago that looked at our response times and Fort Wayne Fire's response times and kind of layered on top of each other. And the kind of thing that we brought in a consultant a long time ago to kind of talk about this, but that what it really showed is that by working together, we actually independently had longer response times. When you overlap us, it reduced by 10% or so. So pretty significant reduction by working together. And I think on our own that probably would not be achievable without a huge dollar investment.
So is it a fair question? And if you don't know the answer, that's fine. Do we have an average response time in the city? What it takes on a, do we have an average, overall average it takes for you all to respond to a call?
Sure. I think ours right now is around 3 minutes and 30 seconds.
Really?
On average.
On a right.
Fire runs, fire alarms, ambulance responses, everything together is about 3 minutes, 30 seconds. So that's
Joel, what are you all running at this time?
So I don't track average response times. What we track is if we get there in a certain time period within 8.5 minutes. So our goal is 90% of the time to make that, and we consistently do it.
So I asked Fort Wayne Fire Department, how they get their EMTs, everybody is, but this the ALS system.
Advanced
Life support. I'm there. I'm getting my acronyms together. What does it take, Joel? What's the process to start, being an EMT for TRAA?
Well, for us, we take people who have done class work on their own, gone through Ivy Tech or another EMT program through a fire department. A lot of people around here are invested in that. We also have a program.
How long does that normally take? Those certificates?
2 months or so.
Okay.
2 months to do an EMT program, and then because we've been short-staffed, we started our own program, Achieve Your Degree program, where you come in and we pay for your time when you're in class, pay for your study time, wages, and you're a part-time employee. As soon as you complete the class, then we hire you on as a full-time person to kind of roll right into, our work organization. And then the paramedic level, which is really the next big level that we have a lot of folks, that's a 2-year program, so that's a major commitment. A lot of our folks, actually probably half of our folks now have come in through the Achieve Your Degree program, and a significant portion are now going on to become paramedics. So
where's the paramedic program offered? Is that here?
So there are several, again, locally. Ivy Tech has a program. There is an organization, School of EMS, that we host for.
A School of EMS?
That we're affiliated with them, that they use our building, and a lot of people have gone through that.
There's it's an online program that allows you to learn online and then do your clinical time in the community in which you work and do this.
So are our ALS firefighters trained internally, or do they have to go out and get certifications somewhere else? How does that work?
Ours have been trained internally.
It's internal.
Some of them have been hired in with the certifications, but for the majority of them have been trained internally.
So as fire technology advances, EMS technology advances, what would you say is the hardest part of being an EMS person, tech? Or, that made you chuckle?
Oh, that's a good question.
Is that a loaded question?
Yeah, so, it's kind of interesting. EMS is always physically, this is different than the fire department. Physically, it's not really that difficult. There are bursts where you're lifting a patient from behind the toilet, and it's, and mentally it's a little bit of a challenge because you're, am I doing the right things? Am I getting this person the right medicine? Am I, is this the right heart rhythm, that I'm following the process of treat? But I think that there is, and this is true for the fire department also, there's a compounding of, you're on bad run, and just, somebody else's worst day, you're a part of that over and over again because you don't respond to those things. And people don't think about that. And historically, that was always something that was kind of taboo. Now I think it's a lot more openly talked about, communicated. Mental health is a much bigger component for me as an administrator. That's something I think about for my people, and I know these guys too. We do debriefings together. There's a team, that's kind of really invested in helping our folks, and I think that's probably the most difficult component for people. But because it's a struggle, and it's not something you can see. You can see a broken arm, right?
Right.
You can't necessarily see when somebody's dealing with something, and so to break that out, address it, that's a challenge for us as an industry, really.
And I really appreciate that transparency because we, as the public, who we know we need you, we know that we need your services, but to imagine having to run into a burning building every day, or imagine having to administer CPR, you don't have to imagine, you all know, every day, the mental taxation on your brain and your body, that's a lot. And thank you for sharing that. I'm assuming there's intentionality to give people relief. You're dealing with scheduling. You're like, okay, we've had a lot of runs. It might be time for a little vacation. But mental health days are critically important.
Yeah,
So I would say on a fun note, if you had a superpower, an EMS superpower, how would you or what would you use that superpower to do for EMS as a whole?
I think mine would be try to prevent the emergencies before happening. You know, just keep the goal is always to keep our patients safe and take care of them. So to try to prevent that from even happening.
Yeah.
Power.
How about you?
I think we all want to not use the skills that we've been trained to use. Right?
You guys
That's
are
the
great.
goal.
Yeah.
I mean, to not have to use those. But I think it's important to portray that we're here every day. Both agencies are here training and simulating and doing things that are going to prepare us for, you know, potentially somebody's worst day.
Yeah.
Best care possible.
Yeah. Joel?
You know, so I think if I had a superpower, it would be firefighter strength. I'd say that. Because we are often lifting patients and getting them out from very, unconventional situations, out of the bathtub, out from behind the toilet, out from beside the bed, and so if I had a superpower, it would just be able to levitate that.
Yeah.
So that we didn't have the back strain, because that wears you down over time too. So
It does. It does.
practical
So
application.
I want to say thank you to all three of you. I think this has been a very informative conversation. And I like that we had the opportunity to see that there is a partnership, but there's the same level of commitment as well. Even though technically you're a semi-governmental, intergovernmental, all the things. But at the end of the day, it's about taking care of the people. Place that call to 911. So, keep being great leaders, keep being a great leader. And I just thank you for your service, because again, if nothing else, we know it's not for everyone. It's not everyone's calling. But those of you that have stepped up to be of service and to save lives, I thank you. Thank you for your commitment. Thank you for your time today. All right?
Thanks for having us.
Absolutely. So that ends our conversation. I hope you all have learned something about EMS. That it's a partnership. That's how we get things done. We get to you between 3 to 10 minutes. So just know that you have a good group of individuals that are here to help and to serve you in your time of need. We'll see you again next month. Thank you.